Thyroid cartilage is way up here. Okay, so you got to get it. You got to follow the trachea all the way up, and then that little bump over here, the thyroid cartilage, that's the larynx, the region of the larynx inside. So you got to clean this up a little bit more, but the thyroid cartilage is going to be right there.
Okay. iPhones out. Wow.
What's next?
And then of
So you
course
got
the
one over
trachea is
here.
right below it.
Trachea is this, obviously.
Esophagus.
The esophagus
It's behind the trachea.
is behind the trachea.
This.
Imagine dropping your phone.
Into
Oh
the
my
bag.
god, I would cry.
There it is right there, right? This is the esophagus is this large structure right here. Okay, esophagus. Go ahead.
Next we have the thorax, the pleural membrane.
The pleural members, you have the parietal pleura right here. This is the lining, and then the visceral pleura is on the lung. So if you just touch the surface, it's adherent to it. So that's the visceral, and then the parietal is just the shiny layer. Those are the membranes. That's it.
Lungs.
Lungs are here, obviously.
Trachea again, esophagus.
I did them twice, right? So you've got to really know those, I guess.
Heart and the diaphragm.
Heart is here. Diaphragm is here.
Abdomen. Greater omentum.
This is your greater omentum.
Abdomen.
Ooh. That looks nice. Wow.
This fat sheet.
And then a lesser omentum.
And then the lesser, let's see if we can find it here, is, well, this is really lesser. It's gonna be right in. It's really like, well, I think it's gone now. It's this connected. This you'll find a fatty sheet similar to this, much smaller, connecting the liver to the stomach. It's gonna be right in here. So this really is the only remnant of it. Most cats will have some sort of fatty tissue right in here. So the greater is this large apron, often described as an apron of fat, and picture a much smaller one going from liver to the stomach. So this may have, I don't know what that is, but that may have been part of it, but that's where you would find it. So spread that apart, and right in there between liver and stomach, there you go.
Okay, and then we have mesentery.
The mesentery is this kind of web-like membranous structure, very nice right there. You see this here with the blood vessels? Okay, that's the mesentery. And it's gonna, you can just keep poking around any place, and you'll see it spread throughout. In the large intestine, it's called the mesocolon, but I don't think I gave you that. So just the mesentery, that's fine.
We have the stomach and small intestines.
So the stomach is obviously here. Okay, that's the stomach, and the small intestine is what I was poking around here before. That's that.
Cecum.
We got to find the end of. Here's the large. So right here is where the small goes into the large. So this little piece hanging off here is the cecum. Notice the cat has no appendix. So here we have the small coming in. This would therefore be the ileum. This would be the cecum, and the ascending, transverse descending, which you're not doing. And then if we cut this apart right in here, that would be the ileocecal junction.
So that was the next one. And
Okay.
then we're going to go down to large intestine. You showed us.
Showed you that.
Liver is next.
The liver is all this right here.
Then we have gallbladders, spleen, and pancreas.
Gallbladder is right here. Okay, there's your gall.
That little thing?
Well, not that, but that. There's the gallbladder. The spleen is here. That's the spleen. And the pancreas, we have to try to find, let me see, the stomach. There it is. Right in here. This, I believe that's it. Is that the...
Wait, what's the stomach then? If you said that one was
Wait a
the
minute, I'm just
spleen?
trying to... This is the spleen. This is the stomach here.
Oh, okay.
That's the spleen. And the... I'm trying to find the pancreas. I believe this is the pancreas. The pancreas nestles right into the duodenum. I think this is right in here. Have they clean this up a little bit more? But you want to find the stomach, find the duodenum coming off of it, and tucked right in there is going to be your spleen, your pancreas, and I believe it's right in there. That kind of looks like where it should be. You'll have to clean up a little bit more, but that's the region where it's going to be found, right in there. What else?
Heading down to the kidneys, or over to the kidneys rather.
There's one nice kidney there. Other one right there.
The cortex medulla. That's we're gonna.
We'll slice those open. We'll get those from the model and from here. It's easy enough.
pelvis, artery, and vein.
Which one?
Of the kidney?
Oh, okay.
Of the kidney, I'm
So
sorry.
here we have, on this kidney, you can see that if you trace this back, here is the inferior vena cava, here is the renal vein, next to it we have the renal artery going back to, I believe this is your inferior vena cava with some branches coming off. I eliminated a lot of the branch, but this should be the inferior vena cava, and again, just branching off of that. At this point here, you can kind of clean it up a little bit, and that's going to go over to the kidney. So here you have the renal artery, renal vein, and I don't see a
What was this up
ureter
here?
on
This blue?
this.
The blue
That's
trunk?
that's one. This is the inferior vena cava. This whole thing,
And did you say that was inferior vena?
Yeah.
the whole thing.
No,
Like
no,
the
but you
red.
said the red was vena cava.
No, this is the aorta.
The red is the aorta.
This is the aorta, and then off, and this is the aorta going on down. And here you can see the external iliacs branching right here, the median sacral. So that's the aorta going down and branching. This is your inferior vena cava coming on up. Here we have the renal vein draining back into it. Here it is on the other side, and then adjacent to that, you have the renal artery, which is branching off. Here is the attachment, the branch right off of the aorta, and it's going down into the artery. On the other side too, I think we can see that. And I don't see on this cat, I do not see a ureter, which would be coming right out here and traveling on down to this structure,
Bladder.
which is the bladder. So sometimes you can actually see where it attaches, but I don't see the attachment on this one. So on some other cat, try to find that ureter coming on down.
Can you see the pelvis, or do you have to cut it open to see
The
that?
pelvis itself?
No, I think the renal pelvis.
Oh, the renal pelvis. Oh, okay. See, you got to qualify. Okay, the renal pelvis. Yeah, you got to cut that open.
gotta cut it
It's going to be right. It's going to be right in this area right here. So you can look at that in the model, but slice that open like a book this way. Flap it open. Don't take it off. Just open it so you can see the inside. We can flap it closed, but you'll have the cortex. You have the capsule, the outside, the cortex, the medulla, and the pelvis, the renal pelvis. What's next?
We have the ductus deferens, vas deferens.
Okay, right here. There's one. Comes around, and on the other side, maybe up there it is. So we have two. There's one there. There they are, both of them. Just lateral, inferior and lateral to the bladder.
Those were what again?
Vas
Vas
deferens.
deferens. We need a female for those. Next is the arteries, pulmonary artery, and pulmonary trunk.
So pulmonary artery trunk, that's kind of tough. It's hard to see. It's going to be medial. You got to get the lung. You're going to have to clean this up more. It's going to be deep. You have the superior vena cava, the aorta, and then tucked in between, because it's going to go down this way and then branch out. So that's kind of a tough one, if that's any indication regarding an exam
The
question.
trunk?
The pulmonary trunk.
Okay.
Pulmonary trunk, pulmonary artery. In humans, we typically say pulmonary trunk, and then that branches into pulmonary arteries. They will often call the pulmonary artery, which is the trunk. I don't like that. I like trunk and artery. So the trunk is the branch. The trunk is that great vessel which comes out of the heart, and that's going to be in the region between the superior vena cava and the aorta. Hard to see, so maybe we'll know where it is, but I don't think it's going to be a big exam issue. But that's where it's going to be, in there. You got to kind of flip it around and do some dissecting, and I don't want you to really go crazy doing any more dissecting
It's going to
today.
be the same thing with the thoracic aorta. That's what's next.
Well, the thoracic aorta, that's going to be anything above the diaphragm. So if I pull the diaphragm back and I look right in here, okay, right in here is going to be your thoracic aorta. So you got to kind of clean that out a little bit. There it is, right there. As a matter of fact, there it is. Can you see that? There it is. There's your descending thoracic. Oh, that's very good. Thank you. There it is.
So until it pierces the diaphragm, it's thoracic, and then it's
Right.
abdominal aorta?
Right. So you would have your ascending thoracic aorta, the arch of the aorta, the descending thoracic aorta, pierces, you have your descending abdominal aorta, and then you're going to go to your external iliacs, femorals, and all that. Oops, sorry.
So that here.
Brachiocephalic.
Which one?
Left common carotid, right common carotid.
Okay.
You
You know, if it's hard to get to, we could just like.
You know, why don't you work on these a little bit more? We did the organs, work on the blood vessels, try to clean these up, see if you can come up with them, then call me back and we'll do it as a separate session. All right? So all these phones are, all this radio.